common dental myth debunked. There's so much information you hear on TikTok, on Instagram, everywhere. And there is so much confusion. What is good for you? What is bad for you? What are the healthy trends? What cause cavities? Can I actually reverse cavities and make it feel better? Can my abscess go away and I can heal it? Oh, there is a lot of myths. Well, let's dig in. I'm Dr. Olga Dolghier here at Palm Valley Pediatric Dentistry and Orthodontics. I'm gonna talk to you about all this interesting myths we heard on your TikTok. Let's focus on that. Number one, sugar, that's the only substance which causes cavities. If I don't eat sugar, I will never have cavities ever. Well, there is some instances when understanding what sugar is actually more complex. Sugar is actually, we call it carbohydrate. So there is a simple carbohydrate and complex carbohydrate. So if we're talking about carbohydrates, when you eat, they break down to simple sugar. So if you eat candy and if you eat chips or goldfish crackers, for your mouth, they are pretty much the same because they're going to be broken down in your mouth to a simple sugars. Does sugar cause cavities? If you have bacteria in the mouth, we call strep mutans, and that bacteria is present pretty much on everybody in our population. So bacteria, in order to cause damage, has to stick to the tooth. What is the glue? The glue is simple carbohydrate, sugar in different forms. So if you eat rice, is it a sugar? Yes, it's simple carbohydrates. It's a form of sugar in your mouth. So what can you do? Your typical answer is make sure you brush and floss, make sure you don't eat frequently those simple carbohydrates. Because what happened next after bacteria, the strep mutant got on your tooth and used the sugar as a glue and stuck to your tooth? What does bacteria do? Bacteria is consuming the sugar. She eats sugar. And what does it do after that? So it produces acid, okay? Technically it's poop of the bacteria, no. So it poops on your tooth, technically that bacteria, and it poops with acid. And the acid erodes enamel. Enamel is very strong. It's stronger actually than a bone in your body. So what it does, it dissolves enamel. And now you have dental erosion, and then after that it gets deeper and deeper and deeper. If you don't brush off the plaque, which is bacteria poop, that's how cavity forms. So is it just the sugar? The answer is it has to be all those elements in order for bacteria to actually damage your tooth. So for example, if you ate, I don't know, a bag of chips, right? One time you went and ate the chips. Now you waited about like 20 minutes, you wash them down with water, which I would strongly recommend if you do that. And then in half an hour you went and you brushed your teeth. Did it create damage? Probably not. But if you watching, for example, TV or playing video games, and you have a bucket of chips or popcorn and bucket of sugary drink, and now you're eating and watching, right? Cola and chips for 2 hours. Did your mouth had time to recover from the acid attack from bacteria? No, it didn't. How can you improve that? For example, chips are worse than popcorn. Popcorn is better because the carbs in the popcorn is more difficult to digest for the bacteria. Also, if instead of drinking sugary drink, you washing it down with water, you automatically cleaning the bacteria plaque from your teeth. So if you're eating something you're not supposed to, at least wash it down with water and ideally wait half an hour and brush your teeth. Don't brush right away. Believe it or not, if you ate the candy and went straight to the sink and started brushing your teeth, you're brushing off enamel. And actually, since we're talking about this, I don't know if you know, but if you vomited for some reason, the first instinct you have, you want to go and brush your teeth. Don't do that, because if you vomit it, you have this all acidic content of your stomach in your mouth hitting your teeth, and now you technically have weak enamel affected by acid, and you're brushing off your own teeth. You're brushing off calcium from the enamel. So wait, or drink water. Just drink water and wait with a toothbrush, because toothbrush is brushing off enamel. So another common myth, harder toothbrush brushes better. Not really. We actually now, I believe it's only soft toothbrush you can buy in the stores, because historically some people who are very enthusiastic about brushing, they brush so hard that they created gum recession. You have to ungulate properly your toothbrush 45 degrees to the gums and brush next to the gum line, brushing off the tooth, not the gums. And people who are doing 90-degree angle and brush so hard that they actually creating erosion, and hard toothbrushes actually can brush off enamel as well. So soft toothbrush is a golden standard. By brushing too hard, you're not creating better oral hygiene. You're actually damaging your teeth more. So you have to be gentle, right? Ungulation. That's how you should do the proper brushing technique. Common question again, flossing first or brushing first? Flossing always first. Because think about it, when you floss, you get all this bacon or I don't know, whatever you ate from your teeth. Now it's on your teeth. How are you gonna get rid of it? Brush it off or rinse your mouth right away. So that's very important as well. Another common misunderstanding is white teeth is sign of health. The teeth are healthy if they're white. Well, we all have different amount of pigment in the teeth. There is a different shade of white. It can be A shade, B shade, or C shade. So it depends on your actually heritage, where you're from. I am Northern European. So Northern Europeans are C shade. So my teeth are white, but they're not A or B. The C is gray. B shade is more kind of bright and white. Actually, is the nicest shade is B. A is more yellow. So there's a lot of certain regions, they have A shade. So that's the difference, A, B, and C. And sometimes when you have fluorosis, when you had too much fluoride, or you had some kind of misformation of enamel when you were still in mommy's belly, or when you're very young infant, some changes in the health can change the absorption of matrix of calcium. And as a result, you're gonna have different white. So you might be white teeth, but they almost look too bright. That's actually not a healthy teeth. Too white might not be healthy. It might be fluorosis, or it can be some type of hypoplasia. So white not necessarily healthy, and to have that bright white smile, you shouldn't worry. You should worry about the health of your teeth. A lot of times mom asking me a question, oh my God, John, you just had 4 front teeth and lower and upper teeth and they look yellow. Yes, baby teeth we call milk teeth. So when you get brand new adult teeth, again, adult teeth, it depends, enamel is not fully formed, so they do have that yellowish color to it. And as long as you keep them clean and healthy, that's normal for Johnny. And compare milk teeth white with kind of yellowish teeth, then all this misconception is happening. Can we bleach him? You can, but do you need to? 8-year-old? You can after 10 usually, but I don't think it's necessary. So think about it, what kind of color or on the gum of the color of the teeth your teeth are. Are you A, are you B, are you C? Because this is all white and this is all normal. Those are main misconceptions which I hear every day. What about you? Did your grandma tell you something about her teeth, that she lost all her teeth at the age of 20 because of bad genes? Share with me. Let me know what your common belief is in your family, and I can debunk it for you. Thank you so much for watching. Bye.